ਜੋ ਸਾਡੇ ਸਾਰਿਆਂ ਦੀ ਜ਼ਿੰਦਗੀ ਨੂੰ ਛੂੰਹਦਾ ਹੈ, ਪਰ ਅਕਸਰ ਸੰਕਟ ਦੇ ਪਲਾਂ ਤੱਕ ਇਹਦਾ ਜ਼ਿਕਰ ਨਹੀਂ ਹੁੰਦਾ। ਉਹ ਹੈ ਹੈਲਥ ਕੇਅਰ ਪ੍ਰੈਫਰੈਂਸਿਸ, ਯਾਨੀ ਕਿ ਸਿਹਤ ਸੰਬੰਧੀ ਇੱਛਾਵਾਂ। ਸੋ ਐਡਵਾਂਸ ਕੇਅਰ ਪਲੈਨਿੰਗ ਇੱਕ ਇੰਪੋਰਟੈਂਟ ਸਟੈਪ ਹੈ ਜਿਸ ਦੇ ਨਾਲ ਤੁਹਾਡੀਆਂ ਹੈਲਥ ਕੇਅਰ ਪ੍ਰੈਫਰੈਂਸਿਸ ਐਂਡ ਵੈਲਿਊਜ਼ ਆਨਰ ਕੀਤੀਆਂ ਜਾਂਦੀਆਂ ਹੈ। ਜੇ ਕਦੇ ਰੱਬ ਨਾ ਕਰੇ ਤੁਸੀਂ ਆਪਣੇ ਹੈਲਥ ਕੇਅਰ ਡਿਸੀਜਨਸ ਆਪ ਨਹੀਂ ਬਣਾ ਸਕਦੇ। ਸੋ ਆਪਣੇ ਹੈਲਥ ਕੇਅਰ ਪ੍ਰੈਫਰੈਂਸਿਸ ਨੂੰ ਐਡਵਾਂਸ ਵਿੱਚ ਡਾਕੂਮੈਂਟ ਕਰਨ ਦੇ ਨਾਲ ਆਪਣੇ ਹੈਲਥ ਕੇਅਰ ਪ੍ਰੈਫਰੈਂਸਿਸ ਨੂੰ ਐਡਵਾਂਸ ਦੇ ਵਿੱਚ ਡਾਕੂਮੈਂਟ ਕਰਨ ਦੇ ਨਾਲ ਤੁਸੀਂ ਆਪਣੇ ਪਿਆਰਿਆਂ, ਪਰਿਵਾਰ ਦੇ ਮੈਂਬਰਾਂ ਤੇ ਹੈਲਥ ਕੇਅਰ ਪ੍ਰੋਵਾਈਡਰਸ ਤੋਂ ਇੱਕ ਵੱਡਾ ਬੋਝ ਹਟਾ ਸਕਦੇ ਹੋ ਜਦੋਂ ਤੁਸੀਂ ਆਪਦੇ ਡਿਸੀਜਨ ਨਹੀਂ ਬਣਾ ਸਕਦੇ, ਤੇ ਇਹ ਡਾਕੂਮੈਂਟ ਉਸ ਵੇਲੇ ਉਹਦੀ ਹੈਲਪ ਕਰੇਗਾ। ਸੋ ਤੇ ਹੁਣ ਆਪਾਂ ਚਲੋ ਅੱਜ ਅਸੀਂ ਹੁਣ ਇੱਥੇ ਇਕੱਠੇ ਹੋਏ ਹਾਂ ਮਿਸ ਬੈਨਿਸ ਦੇ ਨਾਲ। ਆਪਾਂ ਇਸ ਯਾਤਰਾ ਤੇ ਚੱਲੀਏ, ਐਡਵਾਂਸ ਕੇਅਰ ਪਲੈਨਿੰਗ ਦੇ ਤਰੀਕਿਆਂ ਨੂੰ ਖੋਜੀਏ ਤੇ ਆਪਣੇ ਪਿਆਰਿਆਂ ਦੀਆਂ ਇੱਛਾਵਾਂ ਨੂੰ ਸੰਭਾਲੀਏ ਤੇ ਉਹਨਾਂ ਨੂੰ ਸਨਮਾਨਿਤ ਕਰੀਏ। So with this, I invite Ms. Sean Bennis to the stage for advanced care planning presentation. Presentation ਇਹ English ਵਿੱਚ ਹੈ, ਜੇ ਬਾਅਦ ਪੰਜਾਬੀ ਦੀ translation ਦੀ ਲੋੜ ਹੈ ਤਾਂ we are here.
Thank you for having me. This is my second time back, so I'm happy to be here. I was here for a very welcoming time for the religious diversity journey that you host here for the 7th graders. My son was in 7th grade last year, so it was great to come back here and be invited, so thank you. So today we will be talking about advanced care planning, all about advanced directives, try to give a good overview of what it is and answer some of your questions. I'm a nurse by background. I've been a registered nurse for over 20 years. And one of the things that I really like talking about is advanced care planning, because I've worked from the beginning of the lifespan all the way to the end of the lifespan with patients and realized just how important it is all along that journey. So I welcome you to take notes. There is some paper up here and some pen if you would like to take some notes. If you provided your email address, I will send you the presentation probably tomorrow morning. I'll send that presentation out to you so you'll have that, as well as any of the helpful links for more information. You'll be able to go to those links as well. So how many people already have an advanced directive? 1, 2, 3, 4, 5, 6. 6 out of about 16, I think I counted. So that's pretty good, considering that the last time I presented, I had nobody, and there was about 30 people in the room. So this is a good crowd. This is great. So some objectives. So I already said we are going to be talking about what is an advanced directive and why it's important to have one, and what a medical durable power of attorney is, sometimes also called a patient advocate, also called a healthcare agent, because in healthcare we like to use many terms to describe the same thing. And how to choose the right person for you, as well as what makes that advanced directive legal in Michigan. So we're really focused on what's legal in Michigan, because every state has a little bit different requirement in order to making it complete. So we're really good at planning in advance for happy occasions. So thinking about weddings, or babies being born, or graduations, or different holidays that you might celebrate. It's an exciting time, and no one has a problem helping you plan for those things, right? But planning for when you get sick Nobody wants to talk about that. Nobody thinks they're going to get sick, but we all eventually are going to get some sort of sickness, right? Can we all agree on that?
Yes.
Yes. So we should be planning for this too, because if we cannot speak for ourselves because we're so sick, then we need to talk with our relatives and our loved ones and maybe our friends and our neighbors about what is important to us and if we do get sick. So advanced care planning is just planning in advance. So planning in advance for what if. And we're talking about the what if when you're still here on earth and alive. We're not talking about after you die and all the estate planning and stuff that goes on after. We're not talking about a will after. We're talking about before. So a little bit of statistics, which might surprise you when we're talking about healthcare providers, and some statistics related to advanced directives. So there was a study in 2021, and it came back that said that about 50 to 75% of people discuss advanced directives with their lawyers. Now, why do you think people talk about it with their lawyers?
You have to put it in a will usually. I mean, we connected it with our will.
Right, because you connect it mostly with a will. Because what? The lawyer actually asks the question, right? So the lawyer actually goes through the list of questions. Do we think it's odd that a lawyer's asking us these questions? No. Is it odd for your doctor to ask these questions? No, but the perception is that it's uncomfortable and that it's strange to ask these questions about advanced care planning. 99% of physicians say that advanced care planning conversations are important. So our doctors are saying, it's important, yes, we should talk about it, right? But about half of them report saying they don't know what to say. So we need to be the patient that wants to talk about it and ask our doctors to talk about it. If you're bringing up the conversation, then they're going to talk about it. Now, the other half of doctors want to talk about it, and they don't have a problem talking about it. So those are doctors that will ask you those questions. But a lot of them are just uncomfortable themselves. So if you're uncomfortable, that's okay, because they're also uncomfortable. And about 77% of physicians have their own advanced directive. So that's pretty good, right? I would say, about 77% is a good number. 65% of registered nurses have an advanced directive. Not horrible. But now we're getting to social workers, which is going even less. And social workers tend to have more conversations about advanced directives. And they have about 41% of them have their own. Now the one that really surprises me is the hospice workers. So hospice are people that are helping people to die with dignity, to die with quality of life at the end of life. And only about 44% of hospice workers have their own advanced directive. So if you're a little uncomfortable or you've never had this conversation before, it's okay. Because even the people that are dealing with this for their job day in and day out are also a little uncomfortable and don't have their advanced directive filled out. So I kind of just want to normalize that conversation, that don't feel bad about it. This is just like the first step towards starting to have the conversation. So the goal of today isn't for you to go home and fill out this piece of paper. The goal for today is for you to start having the conversation with your loved ones. Start opening up the door to having a conversation about what's most important to you and finding out what's important to them. So I have this slide in here as a warning, only because some people might not want to look at images that have like medical machines or things related to things in the hospital. So I have this in there, so if something is unpleasant, I am sorry, but it's going to be related to the terminology that we're talking about. So I mentioned before that you're going to learn about what is a medical durable power of attorney, or what's called a patient advocate, or a healthcare agent. Now, every health system, so whether we're talking about Henry Ford or Corewell or Trinity or any of the others, they may refer to this person by a different term. Or you might see it in different paperwork as a different term. So I just want to bring it to your attention that it means the same thing by saying that it's a person that you designate to make medical decisions for you if you're unable to speak for yourself. So today I'm probably going to say patient advocate because it's easier to say, less words. So some terms. CPR. Who's heard of CPR? Who has seen CPR on TV? And nothing like that, okay? So CPR on TV is nothing that is CPR in real life. But CPR stands for cardiopulmonary resuscitation. Cardio meaning relating to the heart, pulmonary relating to the lungs, and resuscitation means to bring back. So when we're performing CPR or doing chest compressions, we're trying to circulate that blood around your body in order to bring you back to life, okay? We don't know why it's happening, but we're trying to do CPR in order to try to help bring your life back until the medical personnel can come, like the paramedics can come and then take you to the hospital. This may involve pressing very hard on your chest to the point where you break ribs. That is okay. We can fix ribs later. But if we don't press hard enough and do CPR effectively enough, we will not be able to save your life. So, have you done any CPR training here? Okay. So if you have, you realize like how far down you have to push on those dummies, right? And it's even harder with a human because of the bones and things. Many times it's also sending electrical shocks to your heart using a defibrillator. Now I know that I saw a defibrillator here. Yes, where is it located?
In the, where we eat in Linger Hall.
Okay, so where you eat at is the AED. Okay, so there should be nothing standing like in front of it or blocking it. It should be pretty noticeable to everybody. And if maybe you haven't noticed it before because you're like, I just don't remember ever seeing it, just take a moment and locate it, just so that you know where it's at. So that if somebody does say, get me the AED, you know exactly what they're talking about and you can go get it, okay? And you can help in that whole process of saving a life. And then sometimes CPR also involves giving medicine in your veins. So once the paramedics come, you know, they will start an IV, give you some, you know, fluids in the IV, and then can give you medicine that way. So that's all in the process of CPR. Any questions about that right now? Okay. Because that is in like the advanced directive booklet. I just wanted to make sure that we're kind of identifying and exploring these terms a little bit more in depth before you take a look at the booklet, because the booklet is 12 pages long with a lot of information in it. So a breathing machine or ventilator. So many times after CPR, then you're put onto what's called a breathing machine or a ventilator, which then helps breathe for you. So it's doing all the breathing for you. Now, why might you need something to breathe for you? Well, if you've ever had surgery, you may have been put on a ventilator, because while the doctor's doing their magic and performing a surgery on you, your body just needs to be asleep and it needs to just rest so that they can do what they need to do for surgery. But also you could be put on a ventilator because of some traumatic event that happened. Maybe you got into a car accident. Maybe your body is just trying to heal from that trauma and you need to be on a ventilator. There are other reasons too that we could explore in another presentation. But the ventilator is also one of the things that's listed in the booklet. And then there's a feeding tube. Has anyone heard of a feeding tube or tube feeding? Yeah, I see some heads nodding in the room. So this is a tube that's placed in your nose and goes into your stomach, and you get some liquid nutrition put through there. Now, there's a multitude of reasons of why this would happen. Sometimes people who have had a stroke, they're unable to swallow. Now, sometimes you get that swallowing capability that comes back, but then sometimes it's long-term. So if it's more long-term, that's when you would have the feeding tube put into your belly area, like in that second picture there, where it's actually placed surgically into the belly area for a longer period of time. Some people will have this and then they'll go back to being able to swallow again after they've had some sort of therapy to train them how to swallow again. So that's just one instance of why you might need a feeding tube. Dialysis. Have you heard of dialysis before? Some heads nodding again in the room. So kidney dialysis is just simply a machine that is cleaning your blood because your kidney stopped working. Now, sometimes people have kidney failure because over years and years of problems, the kidney stopped working and then they just will never start working again. Now, going back to the traumatic event, so if you're in a car accident, for instance, and all of a sudden your body is in this kind of shock period, your kidneys might stop working because the rest of your body needs your whole body to focus on it. So your heart and your lungs and your brain need your body's focus. And the kidneys are like, all right, I'm just gonna stop working for a little while so the rest of my body can heal. Well, guess what? The kidneys can't just stop working and not have your blood cleaned. Because if your blood's not cleaned, you will develop like an infection in your body and you cannot live that way. So that's why we'd have to put you on dialysis for maybe a short period of time. So there's long-term dialysis and then there might be short-term dialysis. Okay? Any questions about that? Okay? And then a blood transfusion. That's simply replenishing your blood in case you've had any kind of blood loss. Again, traumatic experience like a car accident. You lose a lot of blood. Or some other reason why you're losing blood. You might have surgery and all of a sudden a lot of blood is lost that maybe they did not anticipate. So the doctor may recommend that you get a blood transfusion. So this is something that you would want to consider. All right, we're done with those terms. Are we happy we're done with the terms? Yes, medical terminology is not fun, right? But I have to throw in a few of those to kind of make this document make a little bit more sense when you start having those conversations with your loved ones. So you have a clear understanding of kind of what you're talking about, what that conversation is going to look like. So who is that patient advocate? So your patient advocate, when you start thinking about it, you want someone that's at least 18 years of age, someone that knows you well and can be there for you when you need them, someone that you trust can do what's best for you and can clearly tell the doctors what you want according to your advance directive and according to the conversations that you've had together. So right now, I'm gonna pause and have you think, do you have a person in mind? And you don't have to like tell me who that is. But do you have a person in mind that you're thinking, yeah, that would be the right person for me? I think I have a patient advocate in mind that I'm gonna have this conversation with. So what decisions can that patient advocate make? In a nutshell, they can make whatever decisions you would be able to make if you were able to speak for yourself. So if you have a patient advocate today, but you're still able to speak for yourself, they're not speaking for you. You are still speaking for yourself. This person only comes into play when you are unable to speak for yourself, okay? But they can decide what hospitals are going to treat you, what medical tests that you will have or not have, what procedures that you will have or not have, if you will go under hospice care, or go into a nursing home, or which nursing home that might be. Or maybe you'll come home with hospice care. Or calling in a spiritual leader to come in at your bedside and counsel you and your loved one. So they can make all those decisions just like you would be able to. So the decisions and responsibility of your patient advocate, again, only start when you're unable to make decisions for you. So that's one of the common fears, is that, someone's going to take all my decision-making ability away from me today if I have this. But that's not true. It's only if you're unable to make your own decisions. And they will advocate for you when you need it most. They can remove themselves as your patient advocate if your relationship changes. You can remove them as your patient advocate if your with them changes. So most common is people get a divorce and they've named their spouse as their patient advocate. So if you get a divorce and your spouse, now your ex-spouse, was your patient advocate, you probably want to get that changed because of obvious reasons, right? Or the person that you named as a patient advocate dies. So we really recommend that you review your advance directive at least yearly, and usually like with tax season. So right about now, right? You're kind of reviewing all of those documents at the end of the year, and now it's the new part of the year, and you're paper shredding, or you're getting all of your financial documents together. This is a great time to also take a look at your advance directive and see if everything that you said in the past is still true for you, and if that patient advocate is still the right person for you, or if there needs to be a change. So this is a great website. It's called conversationproject.org, and it has a lot of different conversation starters on there for all different kinds of situations, all different kinds of ages of people and backgrounds of people, and whatever your fear might be, it's probably identified on that website. But some of the things that I kind of pulled out of the website were things to start your conversation with. Say you've never talked about this advanced care planning before, and you're like, I don't even know where to start. Well, the easy one for me would be, hey, I was here and I heard this lady talking about advanced care planning. You want to hear what she said? Right? Just like today, just using today's example of being here and saying, wow, I learned this, whatever that might be. And let's talk about it a little bit. Like, what do you think about this? And try to like feel that other person out of what their views are. Because not two people are going to have the same exact views as you. The person sitting next to you may be thinking something different, may have different wants and needs and health conditions, depending on what other health conditions that you have will also shape what your advance directive looks like. So you can start out by talking about where your healthcare documents are kept. Maybe you have a safe in your house. Maybe you have a specific filing cabinet where you have other documents that are kept. Do your loved ones know where that is? Do they know where your passwords are kept? So thinking about those kinds of things first might ease you into the conversation about, well, if I get sick, this is what's most important to me. Making sure that you share some of your fears or mistrust with your loved ones too. If you have had a bad experience with a certain hospital or a certain doctor's office or a certain procedure that you've had, then you want to share that with your patient advocate that you've chosen. And you want to make sure that that's clear, that they're aware of what your fears are, so that you don't end up in the same situation or with the same healthcare provider or the same hospital so that that can be maintained and most important to you. And then making sure that your religious and spiritual beliefs are made clear to your patient advocate, because they might have a different belief system than you have, and you want to make sure that they're aware of what's most important to you. And even if they have the same belief system as you, the level of belief might be different. So this isn't a typo when I say it requires multiple conversations. You're not going to sit down and get this done in one sitting of 10-15 minutes. It's going to probably require multiple, unless you already have an advance directive completed and you're just reviewing it and looking it over and having that conversation. And if you have multiple siblings or multiple children, you want to try to have the conversation with everybody at the same time. Now, it doesn't mean that they all have to be in the same room. You can do it over Zoom. I have helped facilitate conversations with people all over the country when they've had their sons and daughters living in different states. We've all just joined in on a Zoom and we've had that conversation. And it's been very eye-opening for the children of the person that started the conversation. And a lot of people learned a lot about each other on that call. Like the siblings learned about each other as well as the parents that started that conversation. So completing the form. So if we get to this point where you're like, all right, I'm gonna take this form and I'm gonna actually look at it. I've already had the conversation. So a few steps. So first you need to choose the person that you trust. Have the conversation with them and make sure that they agree to uphold your wishes, that they're able to be your advocate if the time should come. Then make your wishes known in your advance directive booklet, and it'll walk you through step by step. There's check boxes and things in there. A lot of what I said is directly from the booklet, and you'll see the common terminology that's in there. And then you use those check boxes where it says to make a check box here, only choose one. There's all of those prompts throughout the booklet. And then you sign the form while two witnesses watch you sign the form. And then your patient advocate signs the form. Okay, we're gonna go through witnesses in just a second, because there's some rules on those. So ultimately at the end, your document has to have 4 signatures. Your signature, your 2 witnesses, and your patient advocate. Okay? Questions about that yet? Okay. So after the form is complete, you want to always keep your original form. My suggestion is to fill out the form and sign the form in blue ink. Because if you make a regular photocopy, not on a colored printer, it will come out black, so then you'll know it's a copy. Your original will always be blue. You may want to give a copy of this advance directive to your patient advocate, but you also want to take a copy to your doctors, all your doctors, because you never know which one has a better system to getting it into your medical record faster. Each office is a little bit different, okay? And if you see doctors at multiple health systems, you want them in all the different health systems. And then you may want to make an electronic copy of your advance directive and keep it with you. Like a file in your phone is a great idea, especially if you travel. Because if you travel outside of the Metro Detroit area, you're gonna end up, if you get into a car accident, I always use car accident as an example because that could happen to any of us, right? So if you get into a car accident outside the Metro Detroit area, you're going to be taken to a hospital that's not one of the hospitals around here. So they're not gonna know who to call. So at least you have that electronic copy on you. So I use the example too, is I took, my husband and I and my son, we took a 3-week vacation, a road trip across America this past summer. And I made sure we had, everything was digitally on our phones. And of course, my husband's like, of course you're going to do this. You think the worst. I'm like, no, because anything can happen. We can be the best driver, right? We can take every precaution in the world and we can have the best clear record on our driver's record, but anything can happen. We were driving through the mountains. Even another driver might not be the problem. It could have been rocks falling, right? So just making sure that we're extra prepared. So the legal requirements about your witnesses. So remember I said I was gonna go over witnesses. This is the biggest sticking point that everyone thinks is hard, which it's a little difficult, but it doesn't have to be. So the witnesses have to be at least 18 years of age and watch you sign the form. But they cannot be your patient advocate. They cannot be your healthcare provider or work for your healthcare provider. They cannot work at the place you live if you live at like a nursing home or a group home. They cannot be related to you in any way, including in-laws. They cannot benefit financially from you after you die, and they cannot work for your insurance company. So now you're like, who can sign this, right? Well, if the people in this room aren't related to you, they can sign it for you as a witness, okay? Your neighbor can sign it for you. Your friend can sign it for you if your friend's not your patient advocate. So we had a signing party when I had my family do this. My in-laws, my mom, my husband and me, many, many, many moons ago. Everybody had their advance directive completed. I called my 2 neighbors over. They came over and they witnessed all 5 of our advance directives. They didn't read the advance directive. They don't need to know what it says, right? Like they don't need to know the ins and outs. They just need to witness that it's my signature, that no one's making me sign this against my will. It all took about like 10 minutes, but that's because we were talking. It really was not that long of a procedure. I've had other people, they go to their famous restaurant, you know, like every Friday they go to Olive Garden and they have their same waitress. They've had their waitress and like hostess sign the advance directive. I mean, you just sometimes have to get creative. Now, if there's no other choice, you can have it notarized, but you do not have to have it notarized. Let me say that again. You do not have to have it notarized, okay? So you can use any form. You can use the form that we have here today. That's the one advance directive in English. You can use the one that's been translated. You can use the one that's on the Michigan.gov website. You can use a form developed by another health system. You can use the form that is given to you and created by your lawyer. That's not a problem. Just be cautious. The one that is created by your lawyer might also have all of your other estate planning stuff in it, right? Like mine is like 55 pages long or something, right? The doctor does not need 55 pages of stuff because half of that, more than half, doesn't apply to the medical stuff, okay? So make sure that you're pulling out the medical stuff and make sure that the signature page or pages is included in that. That's what will make it completed, okay? Does that make sense? Okay, because the doctor doesn't care, like whose house is getting who, right? Like, don't care if you're giving your car to Aunt Jane, right? They just need the medical stuff. Yes?
So if we have a form that's 55 pages, like you said, does it make sense to fill out this form and just, for example, Henry Ford, just give it to your doctor so it's clear and succinct and, concise?
Yes, so the question is, can you
have
fill out
multiple?
the other advanced directive form that you have here today in addition to the one created by your lawyer? Yes, just make sure that it says the same stuff.
Right.
So that one says, let's just say yes to CPR and one says no to CPR.
Right.
What should we do? Well, we're gonna continue doing CPR until we can sort that out, right? So another question that comes into play usually that I haven't heard yet is that, well, what if I don't have an advance directive? Are the doctors going to do anything?
What's the default?
Yeah, like, bless you. What's the default? Yes, the doctors are going to do everything that they can to save your life.
Yeah.
Okay, they're going to do, they've taken an oath, right, to do no harm. So they're gonna do everything that they can to save your life, until a form or a person comes forth and says, no, she or he does not want X, Y, and Z. Then if there is a dilemma, there's also what's called an ethics committee at the hospital that can then review everything and go through any kind of arguments that there might be amongst family members, doctors, and the patient, okay? So a few additional resources. If you have an iPhone, who has an iPhone? Some people, half the people, okay. If you don't, if you have an Android, you can still get a health app that's an emergency health app. I don't know what it's called, but every phone has something different, is what I've been told. But with iPhone, there is the medical ID. It's called the health app. So paramedics, doctors, nurses, emergency room people, anybody in this room, if they picked up your phone, they could click on this medical ID, which is kind of fuzzy here, but click on that medical ID and we'll be able to see your name, your birth date, any allergies that you have, any medications that you're on, who your medical durable power of attorney is if you've indicated that in there, and your blood type. So you, though, have to fill out all that information first before they can see it. The iPhone doesn't automatically populate that stuff, okay? So if you fill that stuff out, then if you are, again, in a car accident, the paramedics that arrive on scene have your phone and can tap that and can look into that important information and be able to call your emergency contact person and see whatever it is that you put in there, they can see to help them treat you best. Now, if you do have MyChart with Henry Ford or with Corewell or any other health system that might use MyChart, you can view and see what is in the Advanced Care Planning tab of MyChart. So if you do turn in your advanced directive, you can check and see if it's been uploaded into MyChart. So when you click on the menu, you have to kind of scroll down, kind of towards the bottom is where advanced care planning is. It's not in alphabetical order, it's in like the most frequently used tabs that people would choose, is how it's in order. So you would just have to look for advanced care planning. In this then next screen, you'll see if the document has been uploaded into MyChart. So if you give it to your doctor yesterday, they're not gonna be there today. Okay, you gotta give them some time. But this then also allows you the ability to check and double check and ask so that they know it's important to you, especially if you haven't had that conversation yet with them. And then you can just ask the next time that you go in. Or you can send a message to MyChart and ask, like, when is the advanced directive gonna be in? So just one more thing to bring to your attention in case you ever hear of this in the news or you hear of it because of a family member that might live in a different part of the state. It's called MyPost, and it stands for Michigan Physician Order for Scope of Treatment. Now, this is an order that's signed by your doctor that directs end-of-life medical decisions. This is only for people who have a life-threatening condition, to where an advanced directive is for everybody. A MyPost is not for everybody. So if you've never heard of this, that's okay, because it is a relatively new document that has gone through legislation. And there is more information on the michigan.gov website. So I'm not spending a lot of time on it because it's not something that's like readily happening and available.
Could you do an advanced directive even for the situation where there's a life-threatening?
Oh, yes,
So.
absolutely, yes.
So what does?
An
it
advanced
mean about
directive
this?
is
Yeah.
always, an advanced directive is for everyone,
Right.
everyone over the age of 18. So if you have children going off to college, you should be having these conversations with them, okay? Because it's everybody over the age of 18. Anything can happen at college, right? So you wanna also find out what's most important to them. They've made it through the teenage years mostly, right? They've come up with their own ideas of what's most important to them. And so having these conversations early is good. The MyPost has specific instructions regarding like do not resuscitate orders and things related to like a life-threatening, like end of life, end stage cancer, or some sort of end stage disease.
So additional questions related.
Yes.
So, question,
Yes.
how do you work around if the resuscitation is needed for that moment? I mean, it's not end of life for you, or, somebody needs to do CPR, get you a heart attack, get you going. But in your advance directive, it says that no CPR. How would you deal with that situation?
Then thinking through that situation, you don't wanna check off no CPR. Because if you have a situation, a specific situation where you do want CPR, then that's where that conversation with your patient advocate comes into play. You wanna say, yeah, I want CPR for
Yeah.
all of these situations except this one, right? So you would make sure that you wouldn't wanna check no CPR.
And one point I don't think you made it, that you can only make advance directives when you're not demented or when you don't have, when you're in the sane mind.
Correct.
Right. If
Yes.
you have dementia.
Yes,
cannot
if you
make-
have dementia, you wouldn't be able to make an
Yeah,
advance directive
right,
today.
right.
You would then be going down the path of guardianship, and the
Right.
family members and things would be making those decisions.
Right.
Yes, yes. So today we talked all about advance directives, what it is, why it's important to have one, who a medical durable power of attorney is, or what I refer to as a patient advocate, because it's easier, less words. And how to choose that person, and then the legal requirements for an advance directive. There's all the resources and references regarding all of the different slides. You can click there for more information regarding any of the information that's in the slides. And then if you wanna have a one-on-one conversation, I'm more than willing to talk with you. You can reach me by email, phone, on the website. You can get even more information, as well as having like a family get-together. I can facilitate that conversation with you if that would be helpful. Just let me know how I can be helpful, and I will. And Zoom or whatever virtual way is always a possibility. And then if you're on Facebook, this has nothing to do with advanced directives, but if you wanna join the Facebook group for family caregivers, because that's my main role is helping people get connected with community resources to help them provide family caregiving easier. I don't provide caregivers, but I provide the support resources that might be needed in that caregiving situation. So, any other questions? Yes.
So in our advance directive, it's, instead of specifically checking off what we wanna do, we basically, like, there was one box that allowed your patient advocate to kind of make those decisions. Do you think that's, if you've had the conversation, I felt a little weird about it, but I felt like, I think what he was saying as far as like, sometimes the situation is like a little murky because of, short-term, long-term kind of questions about resuscitation or whatever. So, at least our lawyer, when they gave it to us, the option was to just say, my patient advocate is gonna make that decision.
Yeah, they didn't want to be very specific.
They didn't wanna be specific,
Right.
left it kind of wide open.
Yeah, a
Right.
lot of lawyers do that.
Yeah.
So many people do just kind of leave it more wide open, deciding for resuscitation, or any of the other things that I mentioned. So
Right.
resuscitation is just one thing, but then there's also tube feeding,
Tube feeding, all
and
of those.
the dialysis, and the blood transfusion, and the ventilator. So, that's the importance of, and why I said you don't need to fill out this form. The goal of this presentation is not for you to fill out a form. The goal is for you to have the conversation.
Yeah.
Because right now, the conversations was most important, and what's going to leave you today. And in the days and weeks to come, if you have that conversation, then your family knows what's most important to you. quality versus quantity of life. That's totally up to you. Is living as long as possible most important to you, no matter what? No matter if you're hooked up to every machine and every medical thing possible? There's not a wrong answer, right? It's what's ever most important to you, and that's why having the conversation is most important. I wouldn't be able to be your patient advocate because I have no idea what's most important to you, or you, or you, or you, right? But I know what's most important to my husband. I know what's most important to my mom. I'm both their patient advocates. So knowing that is what can help make those decisions. Now, some people are specific in it when they have, say, you know, a stage 4 cancer, and they know that they're not going to receive any treatment. Then they might have an advanced directive that looks different, because maybe they don't want those life-saving measures, because that's the choice that they've made. And then there's some people that are very, very young that don't want any life-saving measures, and there's some people very, very old that want everything. So it really, really depends. So be as specific as makes you comfortable, but if you have way too many situations, just keep it broad, right?
And the form has options to be broad. You can choose whether only CPR or how you want to do with your DPOA. You want him to choose at that time, or you just want to go with those wishes.
Yeah.
So
Yeah,
there are
the
multiple
form allows you
options
to
on
be
it.
broad or specific,
Right.
but if you're worried about being specific, then stick with broad. And make sure you're having that good conversation with your patient advocate. And that you trust your patient advocate. That's why one of the very first slides was, you know, choosing someone that you trust can make those decisions for you and be able to clearly tell your doctor what those decisions are. If someone is clearly has a different view on what decisions are that are good, then that might be the wrong person for you. So just because you're married does not mean your spouse has to be your person.
For sure.
Or you know, you don't always have to be your mom or your dad. Like, they can choose a friend or a neighbor. They don't have to be blood related to you. Like, when I was single, my mom was not my person because she had a different view than I did. So it's each person is different. Great questions, though. These are like the common questions that I'm just gonna include in the presentation next time.
I think
Yes.
having this uncomfortable discussion is the key.
What she's saying,
Yeah,
yeah.
it is.
Can you say it louder for the people in the back?
I
I know, I'm kidding, I'm saying, like, yes, having the conversation is what's most important.
Yeah,
So even if it's a 2-minute conversation,
yeah.
have it, you know, and using this presentation as that starter, like, hey, look, you know what I heard today? That can help.
I'm disappointed that my Henry Ford doctor never brought this up. He's one of those 50%.
Or.
But now you can
the
give
timing.
give your Henry Ford doctor the advanced planning thing.
Yes.
It was so good, so
Yes, what you can do then is take this form then to your doctor and start that conversation.
I
Yes.
just want to say thank you so much.
Thank
You know,
you.
it was very, very clear. You emphasized, all of the key points.
Thank
Really
you.
appreciate it.
No problem, no problem.
Thank you.